Medication and pregnancy. What you need to know. Welcome back to our channel. Today we'll be discussing an essential topic, medication and pregnancy. If you've been an expectant mother or planning to conceive, understanding the safety of medications during pregnancy is crucial. As always, remember to consult your healthcare provider before making any decisions. Pregnancy is a miraculous journey, but it comes with its unique challenges. Many pregnant women may face health issues that require medications, but not all drugs are safe during this sensitive period. Always remember, what you put into your body affects not just you, but your little one as well. When you're pregnant or planning to conceive, your first step should be to schedule a comprehensive consultation with your healthcare provider. Discuss any medications you're currently taking or planning to take, including over-the-counter drugs and herbal supplements. The U.S. Food and Drug Administration, or FDA, categorizes drugs into different classes based on their safety during pregnancy. These categories range from A, considered safe, to X, contraindicated. Understanding these categories can help you make informed decisions. While many medications may be safe during pregnancy, some should be avoided altogether. For example, drugs in the X category may pose significant risks to the fetus. Your healthcare provider will guide you on which medications to avoid. Some pregnant women have pre-existing health conditions that require continuous medication. In such cases, your healthcare provider may need to adjust your medication or find alternatives that are safer for both you and your baby. Morning sickness is a common pregnancy woe. Luckily, there are safe remedies that can help alleviate nausea and vomiting. Your healthcare provider may recommend specific over-the-counter options or prescribe medications if necessary. Mental health is crucial during pregnancy, but some antidepressants and anxiety medications may have potential risks. Don't stop taking prescribed medications abruptly. Instead, work with your healthcare provider to find the best solution. Many people turn to herbal supplements and home remedies, assuming they are safe during pregnancy. However, some herbs may cause complications, so it's essential to seek professional advice before using them. As your due date approaches, discuss your birthing plan with your healthcare provider. Ensure they are aware of any medications you've taken during pregnancy, as this information can affect your labor and delivery choices. Breastfeeding mothers should be cautious about medications. Some drugs can pass into breast milk and affect the baby. Your healthcare provider can recommend breastfeeding-friendly alternatives if needed. As we wrap up, remember that every pregnancy is unique and medication decisions should be personalized based on your health status. Communicate openly with your healthcare provider, ask questions, and prioritize you and your baby's well-being. If you found this video helpful, give it a thumbs up and consider subscribing to our channel for more health and wellness content. We care about your journey through pregnancy and beyond. Thanks for watching, and we'll see you in the next video. My name is Pharmacist Michael. Be happy and be healthy.